Today, I want to tell you about the treatment superpower you probably didn't know that you had. One that's completely free and can cut the chance of your cancer coming back by almost 50%. That's really significant. It's as simple and as difficult as managing stress, which is why I'm so committed to you feeling comfortable and satisfied with your treatment plan. The last thing you need is to feel worried or uncertain during your cancer treatment. Hello, and welcome to Elevating Cancer Treatment, where we explain the science and debunk myths to help you navigate your health journey. My background is a little different. Beyond educating about cancer, I'm actually designing new drugs that are defining the future of oncology. This direct hands-on experience offers me a very different perspective of how these cancer treatments work on the body, interact with the cancer cells, and cause side effects. And these are insights that I'm excited to share with you. If that sounds interesting, make sure to like this video, subscribe to the channel, and hit that notification bell so you never miss an update. And please share it if you find it useful. I'm Dr. Jay Chaplin. An important reminder, I'm a PhD, not an MD. The information in this video is education, and it's not medical advice. Every cancer is unique, and no general information applies to everyone. Please remember that. Always consult with your healthcare provider for guidance on your specific situation. And two quick things. First, as a thank you for being here, I've created a free resource, 10 Things to Elevate Your Chemo Journey, which you can download from the link below. And second, by signing up, you'll also get updates on that innovative cancer treatment I'm working on. I'm confident it represents a significant advancement in immunotherapy. So please take a moment, download your free guide, and join us in shaping the future of cancer treatment. Okay, we're not even talking about staying positive here. We're simply talking about managing chronic stress, meaning the anxiety and the depression that can be debilitating and feel normal. Managing stress is an easy thing to talk about, but takes much more effort to actually do. So is it worth the effort when there's so much else on your mind right now? Let's take a look at the data. So Keytruda, pembrolizumab, it's the most widely used immunotherapy. That decreases cancer recurrence by about 35%. So you get treatment, you get Keytruda as part of it, your chances of cancer coming back decrease by 35%. More precise examples of this come with different individual cancers, say 35% for melanoma, 40% for non-small cell lung cancer, and 32% for renal cell cancer. This is a game-changing, multi-billion-dollar drug. It's sold $142 billion since it was approved in 2014. So, in contrast, in well-controlled studies, therapy to address stress factors reduced cancer recurrence by 48%. A prospective study on stress's role in cancer showed a 32% increase in mortality in the group that reported higher stress levels, so you obviously want them to be low, and another prospective study with really well-defined measures of stress showed a doubling in the mortality rate in the high-stress group. These numbers show that effectively managing stress in your life has at least as much impact, possibly much more, than the most used immunotherapy drug today. Now, there are two things that I have to mention here. First, there are many small studies on the role of stress and cancer, and those have all sorts of wildly different data and interpretations, being upfront with you about that. Everything from stress doubling the mortality rate, like I just talked about, to being slightly protective against cancer. So why am I showing you these specific studies? They have a few things that the small studies that the other ones don't. So the first is that they have measurements for stress levels better than waiting for a month and asking you at the end of the month to report how stressed you felt on a scale of 1 to 10. If you did that, if you waited an entire month and someone asked you on a scale of 1 to 10, how stressed have you been for the past month, how accurate do you think that data would actually be? Would you expect it to be really meaningful? That's the way that most of the less rigorous studies have been conducted. The ones that I mentioned tended to have validated questionnaires. The most commonly used one is the GHQ-12, which measures anxiety and depression, and it gives better data, robust data, and that data is collected more frequently. Another reason that these studies are good is that One of those studies is a meta-analysis, and what that means is it's a study that pulls together all of the available data on a topic from many other individual studies. It removes the data when there are issues: poor data collection, bad experimental design, duplication, lack of controls, all the things that you want to get rid of where there's a fault. And it averages what's left. And these kinds of meta-analysis papers tend to be much more meaningful, both from including a lot more patient data and also by having much higher standards on how the experiments are run. The last reason is that two of the studies that I mentioned, they weren't meta-analyses, they're prospective. Why is that important? What does prospective mean? Again, many healthcare studies pull data from national or hospital level databases. They correct for age and gender and hope that everything else is close enough to not introduce bias. This is old data, often from quite a while ago, and there's often no way to ensure that things were done properly or to double check the protocols. All that data, you don't know how it was collected. You don't know that they were asked the same questions. It's all just sort of lumped together. In a prospective study, the experiment is defined before you begin. The same questionnaires are used for everyone all the way through. The relevant data is recorded because you already know why you're collecting it and what's going to be important. Everything is just much more trustworthy and accurate when you define it at the beginning instead of the end. So these are the studies that I'm selecting to show you, and they are pretty consistent in showing a very strong response. An entirely separate reason is that the data from people matches up with what we see in the lab. There's a very reasonable mechanism to explain what we're seeing. We know that the two major stress hormone groups, glucocorticoids and catecholamines, epinephrine, adrenaline, those things, they both make cancer much more of an issue. And they do that by preventing cell death, promoting growth, making the cancer cells more invasive, more likely to metastasize and move to other locations, and dulling the immune response so that tumors are much more likely to escape. These have been consistently shown in cancer cell lines, in patient-derived tumor samples, and in animal models. There's even been a small clinical trial on using beta blockers, which block adrenaline function, in combination with a prostaglandin inhibitor, that's another stress hormone, to block these stress hormones, and the results were really impressive. They still need to be confirmed in a larger study with a more diverse group, but they were pretty good. So these effects seen with stress hormones are a double bummer, as many medical teams will prescribe synthetic glucocorticoid drugs to manage nausea and severe reactions to chemotherapy or immunotherapy. This appears to be a very bad idea for many cancers, especially colorectal cancer. Again, there are some specifics here. It does appear to offer some benefit specifically for pancreatic cancer, but in general, it appears to be a bad option. So they definitely undercut the function of immunotherapies, yet they're often used to manage immunotherapy adverse events. So in general, keeping prednisone, one of these corticosteroid drugs, keeping the prednisone doses below 10 milligrams per day and keeping the course of treatment as short as you possibly can are generally wise ideas. I know some of you are now wondering about this, but stress doesn't cause cancer. And two of the studies that I'm talking about show that. Folks who already have cancer have worse chances of recurrence with stress and stress hormones. But stressed people don't have significantly higher chances of getting cancer in the first place. Think of stress as fertilizing the field. Nothing will grow unless you plant seeds. You can fertilize it all day, but unless you plant the seeds, nothing grows. However, if there are seeds, they'll grow much faster. So what can you do to minimize the impact of stress and stress hormones and maximize your treatment response and your health? It's really easy to say, think positive, but that's hard to do when you don't feel good. If you have access through insurance, through some other mechanism, to cognitive behavioral therapy, CBT, that's a great start. Try to avoid glucocorticoid treatment and talk to your doctor about trying beta blockers. That'll block adrenaline function. In future episodes, we'll also cover great tools both for, one, dealing with sudden nasty shocks, and two, Also for improving general mood, mindset, and emotional regulation, how to generally feel better. Contact us directly if you need resources like this immediately. Please don't settle for uncertainty or hesitant agreement. No matter what you do, find a way to be confident and secure about your treatment plan and your future. It is a positive feedback loop that improves your chances of remission. So, beyond these videos, if you need more personalized guidance or a deeper dive into specific treatments to have your treatment be as effective as possible, I offer one-on-one sessions and medical advocacy. I'm also in the process of developing an exclusive video series that breaks down each cancer treatment and drug in detail, along with interferences to avoid and ways to optimize for the ideal results. You can find information on both of these resources on our website, which is linked down below. Again, if you found this video informative, please give it a thumbs up, click the notification bell, and subscribe to our channel for more science-based cancer insights. Your comments help guide our channel and help everyone else. So if you're comfortable, please let us know, what have you tried to manage stress? What's worked for you? What hasn't worked for you? Let us know. Thank you.